How do I diagnose drop foot? Number one, clinical evaluation. Did you have a stroke? Did you have an injury? Did it just gradually happen? I would say a stroke or a genetic condition. And I look at the symptoms. As I kind of mentioned before, can you lift the foot? If you have any ability to lift, that's phenomenal. That means you can probably get a lot of correction. If you have no ability to lift, that means the signal might not be getting there. And I'm saying like even just against gravity. How tight is the muscle in the calf? Are you tight? Are your hamstrings tight? Are you stiff? Are you so weak that you can't walk? Do you have numbness? So I take a filament or a tuning fork and I actually touch the top of the toes, the top of the middle of the foot. If the person has sensation, or if you have sensation, that means the nerve's working. That signal's getting up to your brain. If it's not, that means it's being blocked somewhere. How long has it been going on? If it's less than a year, that's usually great news, usually pretty reversible. If it's been more than a year, that's usually a little bit more difficult to reverse just because the person's older and it's been going on a very long time. Medical history, do you have surgeries? What kind of diseases? Diabetes, a stroke, neurological disorders? Do you have prolonged sitting? Are you cross-legged? Have you put on a lot of weight? All these things mean there's pressure on the nerves. I watch the person walk. Are they high stepping? Is their foot slapping? Or are they just really stiff through their lower back, hips? If there's a lot of stiffness, loosening all that up, getting the muscles stronger can be phenomenal and very beneficial. And muscle strength testing. So again, the tibialis anterior, can it lift? Can the big toe lift up, that extensor hallucis longus muscles? Can the smaller toes lift up? Because again, it might be the nerve or the muscle can be injured. It could be sore, it could be strained. Have you ever heard of shin splints? That could be the tibialis anterior muscle too sore to work. And sensory testing, I mentioned that. Check the reflexes. That tells you a lot about nerve function. And then number two, here's the actual tests in the office. I actually do an ultrasound to see how inflamed and sore the tissues are, because if it's sore and inflamed and stiff, you might just not be flexible through your ankle. And that's why you have foot drop. But number two is, I actually order tests called nerve conduction studies, or EMG electromyography. These measure the speed and the strength of electrical signals in the peroneal nerve. I send them to a physical medicine and rehab doctor or a neurologist, and they can actually tell me, hey, there's a compression in the front of the ankle. There's a compression in the lower back. There's a compression on the outside of the knee at the common peroneal nerve. So you can actually pinpoint if there's a compression. If there's no signal all the way down from your brain, that means you might have had a stroke or a genetic neurological disorder that's not sending the signal at all. But a lot of the times it's the lower back, the L5 nerve root, the common peroneal nerve on the outside of the knee. You could also have it in the outside of the ankle. You could also just have stiffness in the ankle. Most of the times these tests don't show any conduction blockage. That means it's really as you're walking quite a bit, the muscles then get stiff, swollen, and that's when it compresses the nerve. If you had a normal test, that's phenomenal news. That just means you got to get more flexible and get those muscles stronger. And then when you look at those studies, get an MRI, get a CT scan. Maybe there's a herniated disc, a tumor, some type of trauma. I personally love using ultrasound. I do it right in the first appointment. You could look at the muscles and then compare. Do you have peripheral neuropathy? Do you have compression injuries? Do you have back problems? Do you have diabetes that can get better? All these things improve it. Even if you had a stroke and you have no ability to lift that foot at all, sometimes if you're overweight, have diabetes and weak muscles, getting those better can make a huge difference. But other times you might have Lou Gehrig's disease, you might have multiple sclerosis, you might have a spinal injury like paralysis, for example, a muscular disorder, genetic disorder. That's a little bit more difficult, but there's still great options like electric stimulation and great braces. So at that point, you can do genetic testing, blood tests, neuropathy tests. There's so many. I actually have a book about all this stuff if you have lower leg pain. The causes of drop foot. These are the 7 most common causes that I see. I'm gonna rank them from least common that I see to most common that I see, but I'm gonna throw the national statistics in the United States in there as well. Number 7, tumors and cysts. I'll tell you, personally, I don't diagnose this very much at all. These are very rare. It's said to be less than a few percent, maybe less than 5%, although it's difficult to find official statistics. But you could have a nerve tumor in your brain or in your spine that can prevent that signal from getting down your foot. Again, I don't deal with that. That's probably something a neurosurgeon would deal with. Number 6, musculoskeletal disorders. So these are probably 5% or less of causes, but muscle disorders such as muscular dystrophy or multiple sclerosis as well, which is more of a nerve disorder, that can cause foot drop cases. Again, these conditions can be genetic or progressive. Number 5, central nervous system disorders. So this is actually more common. 5 I think is kind of low, but stroke, multiple sclerosis. I'm going to leave stroke for a different time. I'm going to really talk about that in detail. And I have specific videos on stroke and foot drop and leg weakness as well. You can also have ALS, which is amyotrophic lateral sclerosis. That's Lou Gehrig's disease. These collectively make about 10% of foot drop cases. Again, this is something you'd probably work with a neurologist or a spinal surgeon. These disorders affect the brain or spinal cord, disrupting the neural pathways that control foot movement. Again, this is central nervous system. We're going to talk about great treatments, but again, this is a little bit more difficult to reverse because it's in your brain and your spinal cord. Number 4, peripheral neuropathy. I actually have a whole book on peripheral neuropathy. I think this is very treatable. A lot of sources will tell you that's not curable, but I would tell you 95+% of patients that I see can get a ton of improvement on peripheral neuropathy. Check out my guide below. I even have a full book. Highly recommend you check that out. But peripheral neuropathy is related to things like diabetes and 12 other major causes that I document in the book. It's said that this causes about 20% of foot drop cases. This condition results from metabolic disorders, age, alcohol use, eating high amounts of sugar. Do you know anybody who eats sugar? That's like half of America eats probably way too much sugar and drinks alcohol. Number 3, lumbar radiculopathy. That means lower back pain that's pressing on your nerves. So do you have lower back pain? Even if it's not necessarily hurting, specifically the L5 nerve root, which is your lumbar nerve root, where the nerves come out of your lower spine, accounts for around 20 to 25% of foot drop cases. That can be helped. So this doesn't mean your foot drop's permanent. If you can get your back pain better, get more flexible, there's a lot of great solutions where you can improve that. We're going to go over all that. Do you have a herniated disc, spinal stenosis? Do you have scoliosis where your spine's bent? Bone spurs? I have a lot of guides on lower back pain as it relates to your legs. Check those out below. Number 2, nerve injury. You know what? I'm going to make this a tie for number 1 because nerve injuries are so common and pretty much all of these are nerve injuries. So outside of maybe a stroke or a brain injury or a spinal injury, nerve injury is the number 1 cause. And unless you have absolutely zero ability to lift your foot, you can always get a ton of improvement on these in my experience. Even though I can't guarantee that for everybody, I would say most people in this area can get a ton of improvement. If you have feeling on top of your foot when you touch the top of your foot, and you can get at least a little bit of lifting, I'm going to classify that as a nerve injury somewhere. This accounts for about 50% of cases. This injury often occurs due to leg trauma, biomechanical trauma, leg soreness, stiffness, lower back pain, tight hamstrings, tight calf muscles, tight ankles. Kind of like how you can get carpal tunnel in your wrist, you can get essentially nerve compression or nerve injury through your peroneal nerves or your sciatic nerve or your spinal nerves as they come down. And tie for number 1, I'm going to put strokes because I see a lot of patients that have had strokes. I see a lot of older patients. It's said that 20% of all strokes will experience some type of foot drop. So officially, is this number 1? Kind of, but there's almost 800,000 strokes in America every year. That means 160 cases of foot drop or some type of foot drop complication in America. But now that's when you want to talk about the top 10 treatments for your drop foot. Check out my guide on the top 10 treatments. I rank them from least effective to most effective, including the braces. Check that out right here.